$12 billion out of a $7 trillion budget is a rounding error. But right now, the systems that save 20 million lives are on the chopping block. This is the place where decisions are made, and we're going inside to find out what Congress is missing. I am here on Capitol Hill, ready to go in to talk to some congressmen about global health. There's a lot of things going on in global health nowadays, and these are people who make decisions over money that affect millions of lives. I am here with Vincent Lin. Vincent is a policy expert at Bipartisan Health, been doing this for years, and we're going to talk about three things that Congress needs to know about global health. It seems like it's a pretty critical time nowadays, don't you think, Vincent?
Yeah, definitely. Absolutely. I think, we're seeing a lot of unprecedented changes in the field of global health, especially spending that comes out of here in Washington, D.C.
Point number one, the global health spending is actually just a tiny amount per year. It saves millions of lives, but a lot of people don't really know that.
Yeah, it's a tiny fraction. 12 billion out of a 7 trillion budget. That means for your average taxpayer, maybe it's just a few dollars. So I think they're aware, but I don't think they're aware of the speed at which things have been changing. You know, just over the last 6 months, last year, we've seen massive changes, unprecedented changes, things that we haven't seen in 25 years of global health programs. So I think that is where we're trying to share more information about what all those changes have been within that 12 billion.
So point number two is that we're not just talking about money, we're talking about systems. A lot of people think that billions of dollars for global health are just going overseas, disappearing. It's actually going into systems of global health implementation that have been around, that have been built up really for decades, right? Like PEPFAR, which we know is under attack. What do you think the future holds for PEPFAR?
Yeah, PEPFAR has always had a ton of bipartisan support. I mean, it started by President Bush in 2003, and the legacy carried on by all the presidents since. And I will say PEPFAR is almost here on Capitol Hill like a household name. For people who have been here for a few terms, I think people become really familiar with the success, the incredible success of PEPFAR. I mean, it's a program that's roughly $6 billion a year between the bilateral country-to-country programs. Through PEPFAR, it's about 50 countries and regions, and the multilateral global fund contribution that the U.S. makes. And that saved more than 20 million lives from HIV. And George Bush at the time was responding to an absolute crisis. There were projections that tens of millions of people were going to die from HIV/AIDS around the world, and he, and I give a lot of credit to both him and the First Lady at the time for taking it on as a big project. And it's been amazing. It's something that I think all Americans can be proud of. People here on the Hill are extremely proud of. And I think it does bring us to this moment in early 2026 now where, PEPFAR is really under attack. Like, the immediate future of PEPFAR is very uncertain. There's already been massive cuts. Last year in March, 65% of programs run under USAID were terminated. Back in October, later in the year, 35% cuts to programs occurred, especially on the CDC side that deliver, ARVs or antiretrovirals to about 12 million patients. So there have been huge changes in PEPFAR in the last year, and that is something I'm not sure that people on the Hill are so aware of, because staff here the teams are really small, the members of Congress, and they only have so much bandwidth, and so it's contingent on us to actually bring the information forward to them.
Yeah, I guess that leads right into point number three, which is that these are programs that really affect people's lives. Right?
Yeah. Most members of Congress, maybe they're hyper-focused on their district or their state, and they're pretty up to date on what's happening. Like, any big changes like this, if it were happening in a local town, they would certainly know about it immediately, right? They're reading the local newspaper. But when the cuts are happening in Lesotho, for example, or in rural Lesotho, how are they supposed to know? Where's the feedback or communication channel that comes back to them? And I think that's dependent on us. That's dependent on people in the United States who care about these issues, who are following this. So one of our colleagues, he talked about how the PEPFAR program there has really been down for the last year. And it means the diagnoses for new HIV and TB cases have plummeted. I think it's really important for clinicians, for the general public who's paying attention to and cares about these issues to make their voices heard in Congress. It's hard to explain, it's hard to understand the scale and scope of it. So we try to talk about individual stories as much as possible and how $1 billion of cuts will actually translate into real impact in real people's lives.
So those are the stories we're going to try to talk about today, and those are the points that we're going to try to hit as we go in there and talk about global health. In this video series, I'm trying to explain that it's not just about the money, it's about how this money is being spent. And last year, we thought that global health funding had been cut completely, but that's actually not the case.
Right.
There is some funding out there, but you would really be shocked last year on how it was spent and who got that money.